Good evening. I'm Dr. Dan Eli. I work with Bloom Women Health. Today, I want to discuss with you about male infertility. Male infertility cases are rising, and it is good also that the stigma about male infertility seems to be declining. Rarely do I see male patients, but usually when I'm interacting with women as a gynecologist, some come with their husbands. And we're trying to demystify the fact that whenever there's infertility, it is only of female cause, because many studies have proposed close to 40% of infertility are likely due to male factors. Yesterday and the day before yesterday, I was able to get able to see close to 3 male clients, and I was very happy because they were open to being investigated. Generally, it is believed that if a man is sexually strong and is ejaculating, he may not be having any problem related with male infertility, which is not true at all. As I pointed to you, researchers have indicated that 35 to 40% of infertilities are due to male factors. So today, I want to discuss with you the common causes of male infertility in our clinics. Infections are a very important cause of a male infertility. Unfortunately, by the time at times people present with this kind of complication, failure to conceive or delayed conception, the infections would have happened long time ago. Unfortunately, there are very few patients who can be able to properly recall history of infections they've had in the previous times, or they are not willing to at times engage to discuss about the infections they've had. So the commonest infections that usually lead to male infertility are infections like gonorrhea and chlamydia. But there's also a viral infection of the mumps, which if it happens in young boys after puberty, they are also at a risk of getting infertility. A good proportion of patients who had mumps in puberty at times present with features of delayed conception. So you realize when you investigate them or do semen analysis, you find that the sperm count is a bit lower than anticipated. Another common cause of male infertility are vascular, and in this case it has something to do with if you examine the male client, you may find that they have increased varicose cells. Varicose cells are dilatations of blood vessels. Usually this happens if there's a poor drainage of blood vessels within the scrotal area. And when you have that, it will mean that the ability for the tissue to be able to get rid of free radicals will be a bit impaired, and that in itself would be able to at times affect the function of the testicles. And then besides the varices, usually we have history of trauma, and when you talk of trauma, it relates to so many things. It can be accidents, maybe when they were playing, if maybe a young man during the time, if they used to play games like rugby, and maybe he was kicked by a friend while they're playing football, or fell and injured and the scrotum, at times it can be able to affect the function of the testicles. And then also other issues, other trauma issues we talk about are really the surgeries. For example, if somebody has had a surgery, maybe removing the testicles or correcting a problem, for example, if somebody has had ovarian torsion, in itself can be able to affect the blood supply in the testicle area, and in the process, some of these people end up with low sperm function and this kind of thing. So it's a very common condition. And then, of course, when we're investigating men for infertility issues, some have obvious sexual dysfunction. When we talk about sexual dysfunction, there are many causes. Mainly, we talk about the erectile dysfunction, or some have premature ejaculation. And the two can be caused either by hormonal dysfunction, but also in some situations just a psychological thing. All of a sudden somebody fails to perform because they either think they are not competent, or they think they may not be able to satisfy the lady. So in the process, at times they all of a sudden get some kind of erectile dysfunction, of course coupled with other things like overworking and other drugs. You know, there are drugs like the antihypertensives, and all this can also be able to lead to sexual dysfunction. And then, of course, we talk about hormonal factors. When we talk about hormonal factors, we are really relating to things like the prolactin levels. We're talking about the follicle stimulating hormone level, testosterone levels, and all these kind of things. So if somebody has also hormonal disarrangement, either the testosterone levels are low, the FSH are low, because follicle stimulating hormone is extremely very important in spermatogenesis in static cells. So if somebody that has a very low levels of follicle stimulating hormone, at times you may need to be given supplementation, and that is one way through which we can be able to trigger spermatogenesis, which is a process through which sperms are developed. Of course, now we have other genetic factors. The commonest genetic factor which can cause a problem is if somebody has cystic fibrosis. Cystic fibrosis is it's a recessive condition. Generally, it is a multisystem problem. When somebody has cystic fibrosis, usually they tend to have produce a thick mucus, and then this mucus can be able to also plug the vas deferens, the tube that moves the sperms up, and in the process they can be able to have some form of oligospermia, which is really a structural problem. So we at times also need to investigate them for recessive factors like cystic fibrosis. Of course, there are those who have sexual kind of genetic issues like Klinefelter syndrome. Klinefelter syndrome person usually is a male, but if you did the karyotype, it's not a typical XY, is an XXY. So in the process, usually they have a problem with the spermatogenesis. Their ability to produce sperm is a bit curtailed. Also, when you are investigating men for infertility issues, you need to rule out things like environmental factors, because some people maybe that worked in factories where the heat is so much, and in the process when there is excessive heat can be able to affect the sperm production function. So you need to take that history. And then some people work in maybe, for example, if you got a client who has worked in a factory where they are radio imaging, or if you met maybe a medical person who works in X-ray unit, which are not having proper protection gadget, at times in themselves they can also be able to have problems related with with the male infertility. Of course, lifestyle issues are extremely very important. Every time you are having a client who is in your clinic, you need to take history of things like smoking, history of alcohol intake. All those are extremely very important, because if you don't take that history, you realize that actually smoking in itself, a good proportion of people who smoke, the cigarettes in a way affects the ciliary linings of most of the tubes, and in the process this can also affect either the tubes of the lady, or the spermatic duct of the man. So you need to be able to take history about such. Alcohol, as you know, it can also at times lead to underperformance, because number one, alcohol initially somebody may be interested in having sperm, having interest in having sex, but at times in the process you find that they unable to have sperm well, because they unable to have sex well, because their ability to be able to perform sex gets curtailed because they are weak and this kind of thing. You also need to take history of medication. I told you that those who are on antihypertensives, usually when somebody is on antihypertensive treatment, in a way it affects the blood supply system of the peripheries, and in the process the person can be able to end up with problems such as erectile dysfunction. There are those who take anticonvulsants, or those who have other mental illnesses. Usually those drugs, when you take them, they kind of increase the prolactin hormone levels within the body. And when I told you that when the prolactin hormone levels are high, in a way it can be able to affect ability of somebody to be able to produce the normal hormones, like the follicle stimulating hormone and luteinizing hormone levels normally. Ladies and gentlemen, if this is the first time you are tuning to my channel, I request you to subscribe and like our videos. You can comment and ask questions. I'll be able to respond to each of you later on. And then also in the subsequent video, I want to discuss the management of the male infertility in details. Thank you.